Thank you very much. My name is Adrian Dix. I'm BC's Minister of Health, and I just wanted to, we received quite a few inquiries from the media and requests for interviews today, so I thought I'd make myself available to answer some of those questions. I did have a few things to say off the top, and firstly that I'm honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations, and honored to be here on their lands. I want to start by saying we have received some inquiries about a person who passed away in the emergency room in Kamloops, and there is an automatic process of review in these circumstances, and we can't talk about individual cases, but we know the impact on the lives of obviously of everyone around that person and everyone who works in the ER, who works in a dedicated and diligent way every day. We know in these times, these are very challenging times at Royal Inland and everywhere else, and so we are thinking of that family today. Our hearts are with them. We know that hearts are broken when someone passes away under any circumstances, and so I wanted to start by making that point because I know there's significant interest, and there'll be significant interest in Kamloops about that. I want to speak secondly, just to make a different sort of announcement. Today in Dawson Creek, the government is increasing its and continuing its significant investment in healthcare. People will know that Dawson Creek has been in need and been working to get a new hospital for decades, and that a number of years ago we approved a concept plan, then a business plan, and now we are proceeding. And that today we're announcing the selection. The preferred proponent has been selected for the design phase of the new Dawson Creek Hospital. It will be a standalone new hospital, and it demonstrates our government's commitment to Dawson Creek and to healthcare in the north. And that proponent, as a result of the evaluation process, there were 3 proponents shortlisted for the design early works agreement, and the winning proponent is Clark Builders Turner HDR Architecture was selected, and I just wanted to make that note. I know many people in the north, in particular in Dawson Creek, will be interested in that news. Thirdly, I wanted to talk about the patients in our ICUs in BC affected by COVID-19. We have, and we don't have the full numbers. They'll be coming out at 2:30, 3 o'clock today in terms of COVID-19 cases and hospitalizations. We do know that there are 130 people in critical care with COVID-19 at present in British Columbia. Of those 130, 111, a significant size hospital, are not vaccinated. 10 are partially vaccinated, and 9 are fully vaccinated. All of those, none of those under 50 who are in ICU at present are fully vaccinated. And I just want to make this point that about this question, that this number of people, unvaccinated, sick in our ICUs, I just want to make this point about it. They are receiving some of the best health care we have ever seen in the world. The dedication of our ICU teams, our critical care teams, our doctors, our nurses, our health sciences professionals, our healthcare workers is extraordinary. Our outcomes for people who end up in ICU are, simply put, the best in the world. We are doing an extraordinary job when people are extremely sick with COVID-19 and in our hospitals and in our ICUs at helping them. However, I want to be very plain. Everyone would rather be doing something else, and everybody needs to get vaccinated. And these numbers demonstrate again the seriousness of COVID-19. And if you needed to be in an ICU with COVID-19, you are extremely ill, and it will have consequences for you now and potentially far into the future. And I want to lay out that number for everyone to consider today. Thirdly, with respect to vaccinations and the vaccine card, there have now been 1,101,754 cards downloaded. These are unique cards, so this counts the successful attempts linked to a personal health number. So that's how many people have received their unique cards. 1,101,754 in the very short time in the 2 days since we announced the program, less than 48 hours since we went online, essentially with those cards. That shows, I think, an extraordinary response. And I want to appreciate everyone and encourage everyone to continue to download the BC vaccine card in BC. That kind of response is, I think, a demonstration of people's commitment and their individual willingness to support this program. It's an extraordinary response in a short period of time. Today, I can tell you that 85.3% of all those eligible, all those over 12, have received a first dose of a COVID-19 vaccine, and 77.8% have received their second dose, as we continue to make progress day to day in terms of vaccination against COVID-19. And I think that the continuing work of our healthcare workers everywhere in BC needs to be acknowledged, but also people, in particular young people, who have stepped up and got vaccinated in the last number of days. You'll know that the number of people between 18 and 24, for example, who are now vaccinated is 86%, meaning only 14% of all those 18 to 24 remain to be vaccinated. That number is going up the fastest every day. It's now in terms of our cohorts, our sort of 5 or 6 year cohorts from 12 to 17, 18 to 24, and then 25 to 29 on up. It is the highest level of vaccination amongst those 18 to 24 of all those under 60. And it's rapidly closing in and will pass the vaccination rates of those in the next week who are 60 to 64. So young people understand the need to get vaccinated, and they are leading the way, and I am extremely appreciative of their effort. I just want to say this finally, because we know, I think, that there's a lot of talk, I think, in BC, or there's some talk about choice. And as we know, 85.3% of British Columbians eligible, those over 12, have chosen to be vaccinated against COVID-19. But choosing to stay unvaccinated when we are able to be vaccinated is simply holding a red flag to a virus that spreads to live. You can see it in those critical care numbers. We need to know that after all we've been through, the data is clear, the evidence conclusive, the science definite, and just to say that there is absolutely, with that in mind, nothing heroic in presenting a target for COVID-19. There is nothing altruistic in attracting its infectious aim. There is nothing gained by anyone when someone falls victim to its vicious hold. British Columbia is where it is and has the future that it does because of our practical side. Where there's doubt, we turn to proven facts. When there's uncertainty, we turn to data. When there's dispute, we turn to documented evidence. And when there's conjecture, speculation, and guesswork, we turn to demonstrated science. And for COVID-19, the facts, the data, the evidence, and the science are clear in full view to all of us. Going up against this virus by going on with our daily lives, unvaccinated and unprotected, helps only the virus. Going up against this virus by going on with our daily lives unvaccinated when we're eligible to be vaccinated helps only the virus. Going up against the virus by rejecting the facts, the data, the evidence, and the science of its destructive purpose hurts only us all. British Columbia is a more thoughtful place and will be a better place because of those who see things differently, have an alternate perspective, a contrasting viewpoint. But COVID-19, while it is many things, is not debating us on these questions. The virus doesn't debate us. The only way past COVID-19 is to take the one safer road through it. And for all those eligible, that's the road of vaccination. Get vaccinated, register, book an appointment, show up to receive our shots, get vaccinated. I'm happy to take your questions.
Thank you, Minister. A reminder once again to media on the line to please press *1 to enter the queue, and you'll be limited to one question and one follow-up today. Our first question today comes from Lisa Eusder with News 1130. Lisa, please go ahead.
Hi there, Minister. Regarding these protests that are being planned again outside hospitals next week, what is the province going to do or work with Vancouver Coastal Health to get injunctions outside hospitals or any kind of sort of bubble protection so that patients and healthcare staff aren't immediately affected going to and from where they need to be?
Lisa, I think you mean all health authorities, because of course there were demonstrations in Vancouver, but also in Kelowna and Kamloops and Prince George and many other places that interfered with healthcare in the last week or so. So it's really all of BC, not just Vancouver Coastal Health, and I think you know that. I know you're using that as an example. I would say that we're looking at all of the steps need to be taken to ensure healthcare workers are safe and to ensure patients are safe. There is an absolute right of dissent in our country. You're allowed to express your views, but to interfere with cancer patients and heart patients and grieving families and people who need to use the emergency room is not on. There are places to demonstrate that are not our public hospitals. And I just think, and I say to everyone, that I think demonstrating in these circumstances and interfering with our hospitals and yelling at healthcare workers serves no purpose at all. And Lisa, we're of course reviewing all our options because our priority is to ensure that patients are kept well and are not in any way intimidated, and to ensure that our healthcare workers are kept safe. So we're reviewing all those options.
Lisa, do you have a follow-up?
Regarding the ICU numbers and hospitalizations increasing, and knowing that the majority of those are older people that are in long-term care, what consideration is being given to increasing restrictions at long-term care centers that it is only fully vaccinated people that can enter, and is there anything else that can be done to protect the people living there?
Well, of course, in cases where long-term care homes are either on outbreak protocols or on enhanced surveillance, and as you know, I know about this both personally as a person and as a family member and also as a minister, those steps are taken regularly and are being taken now. In addition, as you know, by October 12th, all healthcare workers working in long-term care and assisted living will have to be vaccinated. And this decision is a difficult one, but it reflects, but I think a necessary one under the circumstances. And health authorities are taking and consistently taking steps to ensure everyone's safe. It is important, though, to remember that social visits and other supports for people living in long-term care, it's people's homes and it's their life. And we need to also try and do everything we can to ensure the other elements that make for a healthy life are maintained in these difficult circumstances. So we're going to continue to do that. We're taking, I think, strong steps to keep people safe in long-term care. The impact of vaccination you've already seen, and we've seen it over the past 8 months in terms of the differences in outcomes before and after vaccination. If that is not evidence for everybody about why they need to get vaccinated, I don't know what possibly could do that. And to say finally, though, that you're right, that there are, in terms of mortality, significant outcomes for people who are our oldest citizens, who are 80 and 90. But in critical care today, unvaccinated, there are 5 people in their 20s, 14 people in their 30s, 13 people in their 40s, 27 people in their 50s, 26 people in their 60s, and 16 people in their 70s. Not vaccinated, and 3 in their 80s. There's another 2 who aren't in our measurement here, don't have numbers. And so what that tells you is that COVID-19 can affect all of us, and particularly can affect young people. And just to say this, that we know, and you know, sorry, I just, I wanted to, I'm just finding those numbers again because I think those numbers are important and they bear repeating. So I'm just going to give them to you again in more detail because those, the ones I just gave you were yesterday's numbers. So I want to give you today's numbers, not vaccinated. 1 person 20 to 24, 6 people 25 to 29, 4 people 30 to 34 in critical care with COVID-19, 9 35 to 39, 5 40 to 44, 7 45 to 49, 11 50 to 54, 21 55 to 59, 14 60 to 64, 11 65 to 69, and so on. We'll be providing this information to all of you. My point is this, that this can affect everybody. And And it is not, it is I think, in this context, with the Delta variant present, a foolish thing to not be vaccinated. It is, of course, and it of course puts stresses on everybody in our healthcare system, everybody else who needs to use our healthcare system. And so I think the message I want to give clearly here today is that absolutely long-term care is a priority in terms of keeping people safe. You can see it in the many measures we take and continue to take. But everyone in society can be at risk from COVID-19, and that's why we need people to get vaccinated.
Our next question comes from Richard Zussman, Global News. Richard, please go ahead.
Minister, I'm sure you've seen the study showing the high average costs associated with treating COVID-19 in hospital. In your introductory remarks, you spoke a little bit about the treatment that people are receiving. What sort of pressure is this having in terms of the cost on our healthcare system? Are you concerned about how high the costs are? And I know this is very un-Canadian, but is there any way to consider that if you are unvaccinated, that you may have to cover some of those hospital costs yourself if you end up in hospital with COVID-19?
No, you know, there's a lot of discussion about the BC vaccine card, how we're not allowing people who are unvaccinated to participate in certain social activities that are optional. But everyone in this country and in this province will receive the health care they need. That is our goal, that is our intention, that is our policy, right? That includes everybody who's unvaccinated. But that doesn't mean that that decision doesn't have consequences. The financial ones, you know, that we can bear together, I think, and that's what we're doing. They have significant costs. They also have significant costs on our staff. We would rather not be treating this many people in with COVID-19. And you see the difference in the numbers, because when we talk about the high number of people, 111 out of 130, I think that's, I don't know, my percentages are sometimes off on these things, so I'm going to leave it there, but I think that number is probably close to 84%, something like that. A group that is 14% or 14.7% of the population now, it's an extraordinary level of need of the most critical care we have, of our critical care nurses, of our critical care doctors, of all our healthcare professionals. So my concern isn't the cost, although the cost is significant. My concern is the cost on our healthcare resources, on the things that all of those people who are providing this care should be otherwise doing, and the human cost. Because whether you're vaccinated or not, this is a vicious virus, and we don't want people to get sick, and we want to help them get well, and we're going to continue to help them get well. We're absolutely going to do that. But I want to say to everybody that there are consequences to going on with your life unvaccinated, certainly not taking other protections either in some cases, and those consequences can include in significant numbers a visit to critical care. And that has consequences for the healthcare system. It has consequences for everybody else who needs care. And it, of course, has consequences for you and your family and all that love you and those that care for you. You can get vaccinated today in BC, and I recommend everyone do it.
Richard, do you have a follow-up?
Obviously, there's been a big uptake with people getting their vaccine card. You mentioned 1.1 million. One of the things that's changed over the last 24 hours is seemingly the ability to download a PDF when you do the card on your computer. Is this a problem that's going to be fixed? I think a lot of people who don't have smartphones were counting on this as an option either for themselves or to help their friends or families. Is that going to be fixed? And are there any concerns around, and I know you were asked about this a few days ago, but in terms of people, the visual check and forging the card, like what repercussions will there be if there's a visual check done and someone ends up in there that is not vaccinated based on a poor visual check?
Well, they're making, I think, our team working on the BC vaccine card, who I want to say, you know, have done an exceptional job. We've asked them to take this measure, which is, for people across BC, liberating. For people across BC, allowing people to do things that in many cases, we haven't been able to do, and come together in ways that we haven't been able to do because of the BC vaccine card. The team at the Ministry of Health that has led this work has done an exceptional job, and they're making adjustments every day. We're getting feedback, and you can imagine a lot of it every day. That's one of the issues we're looking at, and we're obviously continuing to look and to make improvements, and we'll continue to do that. But I want to thank British Columbians for their patience. I mean, 1.1 million people within 46 hours or 47 hours of the card being launched in our province. That I think is a demonstrated. That's a demonstration of the commitment of people in BC, and I'm very proud of the people who've done this work, because this is not maybe unusual in the whole world, but it's a piece of work that had very specific requirements in terms of privacy and other things, and I think our teams have done a good job, and they're working on all of those elements, because people are, I think it's fair to say, making suggestions about how we can make it better every day.
Our next question is from Binder Sajan, CTV. Binder, please go ahead.
Hi, Minister, and just wanted to follow up on that report and the cost to the healthcare system. Just wondering if you can tell us right now the status of surgeries being canceled and how busy hospitals are, because we're hearing that some are quite overloaded at this point. If you can just give a bit more detail, please.
Yeah, overall, I mean, the last, I used to report in detail on surgeries every week in BC, and maybe I'll start doing this again. I think our most recent report, as of the week leading into August 22nd, in spite of the real challenges that occurred in interior health, you know, in Kelowna and Royal Inland in particular, where we have delayed some non-essential scheduled surgeries in order to assist people in responding to significant demands, and in particular demands from COVID-19. So even in spite of that, we've done significantly more surgeries that week than we did in the week of 2019, which is the pre-COVID equivalent. And that really is, I think, shows the impact of both the surgical renewal commitment the government has made, but also the incredible work of our surgeons and nurses and healthcare teams. Because of the circumstances right now, particularly in ICU, we are delaying some surgeries, some non-urgent surgeries at particular hospitals, and so you'll see that. And for the most part, there are a relatively small number of surgeries delayed in the month of August outside of interior health. I think in total there were 20 in the month of August in Vancouver Coastal Health, and that's in some ways not atypical. But we are making adjustments at some major hospitals right now, including and in particular Surrey Memorial Hospital, Vancouver General Hospital, Abbotsford Regional General Hospital, and I believe Royal Columbian Hospital to ensure that we can reallocate staff to make sure we can give people the care they need. And so we're looking, if a surgery has been delayed, our commitment continues to be the same. We're going to do everything we can to rebook you as soon as possible and get the surgeries done. Even during COVID-19, all the pressures, I think our healthcare teams have done an amazing job, and reducing the size of our wait lists everywhere in BC, which is quite an achievement, and over the past year, increasing the number of surgeries August to August, and even increasing the number of surgeries from August 2019 to August 2021, which is a real achievement in these circumstances. So we're going to make those adjustments because we want healthcare workers to be able to be reallocated and to relieve some of the pressure on them in the short run, and to provide the best quality care possible. But if I can say this, and this may sound like a refrain, Binder, but people need to get vaccinated as well. I think we have one of the best vaccination programs in the world. I think the evidence shows that. 85.3% of people are vaccinated. But amongst that small percentage of people who are unvaccinated, there's a significant healthcare pressure right now. With the Delta variant, people who are unvaccinated are unusually likely to end up in the ICU. And there's a response to that. There's an easy response to that. And that easy response is to get vaccinated.
Binder, do you have a follow-up?
I do, and some people say, there are people who refuse to get vaccinated, and others are just hesitant, and saying that maybe if doctors and pharmacists were able to administer all the vaccines, that would make a difference. Is BC looking to do that, and when might that happen?
I think it's fair to say, Binder, that the issue of getting vaccinated or not in BC is not an issue of access. We've had the only two issues really were before really the summer, an issue of supply. In other words, we had to target groups, either age groups or clinically vulnerable. Of course, the first person to be vaccinated were those in long-term care. And now we've had, and we still have, considerably more capacity to vaccinate than we have people getting vaccinated. We keep that capacity in place. We want to make sure that people have the opportunity to get vaccinated. We're going to places big and small, to pop-up clinics, to communities, to schools, to high schools, to community colleges, to university colleges, to universities. We're going everywhere to help get people vaccinated. And you see it, that we're making significant progress every day as we go up to now 85.3%, 14.7% unvaccinated. That number is shrinking again and again, and we can always do better. I sometimes like to say people in my neighborhood are vaccinated first dose immunization at 93.9% now, 93.9% in Renfrew Collingwood. We can reach those levels in Renfrew Collingwood. We can reach them everywhere.
Our next question is from Colton Davies, Radio NL. Colton, please go ahead.
Hi, Minister. Thanks, as always, for your time. Obviously wanting to circle back to the death in the emergency room in Royal Inland Hospital last night that you mentioned. I interviewed her, the 7-year-old woman's daughter, yesterday afterwards, and she said that she hopes this doesn't have to happen to anybody else. And since then, our local newspaper has also reported that apparently there were 3 nurses working to cover 4 zones of patients in the hospital that night, and apparently full staff would be 24, but there were 3, like I say. Just curious, what kind of emergency action could the province take to get more acute care staff working immediately in Royal Inland Hospital, and will the province potentially take those steps?
Well, first of all, as you know, we've talked about this before, Colton, that we've invested money this year, $1 million to increase staffing levels at Royal Inland Hospital and to address what's a continuing challenge in the emergency room there. We've added resources. Kamloops has been a priority over the last number of years, and it continues to be a priority. With respect to the case and the individual who passed away and her family, I understand their grief. I know that everyone involved feels that and can understand that. And what I can say is that there is going to be, as there is in such a case, the issue will be fully reviewed both by Interior Health and potentially through the Patient Quality Review Board, so independently, to get a full view of that. So to comment on that in advance of that isn't the right thing, nor is it in terms of privacy. But I can tell you that that's something that is going to be fully and comprehensively reviewed.
Colton, do you have a follow-up?
Interior Health has maintained that despite the situation at our hospital, there's been more than 300 elective surgeries canceled in the past 5 weeks, and we've heard from the nurses union on the staffing shortages, and we've heard from frontline workers about a significant number of COVID patients. Obviously, the health authority has maintained that people should absolutely still go to the hospital if they do need emergency care. After a death in the waiting room there, and we've heard many stories now of people regularly waiting 4 to 6 hours and sometimes longer. In a general sense, how do you assure people today that they will be treated in a reasonable length of time if they do go to the ER in Kamloops?
First of all, acknowledging the really extraordinary effort that everyone's putting in, and I think they are putting in an extraordinary effort by reminding people, and this is important, with return in terms of the ICU and the hospital. Here's why it's important, Colton. One of the challenges in emergency rooms is the need and the ability to move people from the emergency room to the ward. That's an important issue, and that's why, even though in some ways the surgical programs are not the same as the emergency programs, we need to create space, and that's why we've been taking the steps we've been taking to delay some non-urgent elective surgeries. It's for that reason. We've got to continue and do all the work we did. We've invested a very significant amount in the budget to train more nurses and bring more nurses, and we're going to continue to apply those things. We've added, for people who don't need emergency care, urgent and primary care centers, including in Kamloops, which was the first one and one of the most successful in BC. And but I'd say finally that absolutely, if you need emergency room care, then you should go to the emergency room, and that we need, and we're going to continue to do the work to support our staff, including making other decisions in the hospital to free up staff to support them there. I know it's a challenge. Interior Health knows it's a challenge there and everywhere else. And we've got to continue to respond to that. And it's why we're taking all of the measures, supporting our primary care system, adding urgent and primary care systems, adding resources to the emergency room, including and especially and in particular at Royal Inland Hospital this year, improving our surgical response and delivering very high quality health care as we are right now. And the way that people can help us there, and the people of Kamloops are doing this. The people of Kamloops, if you look at vaccination levels in Kamloops, I think they're across the two community health service areas that Kamloops represents. I think the vaccination rate's between 82 and 83% today, first dose immunization, which is close to the provincial average and certainly a very good level of immunization, but we need it to be higher. So these are all things that we can do together, but absolutely, if you need to go to an emergency room, people should go to the emergency room.
Our next question is from Tim Petrick with Castanet. Tim, please go ahead.
Hey, thanks for taking my question. Following up on what Colton asked, is anything specific being done now to address the situation at Royal Inland, specifically in response to the death of the woman that you mentioned?
Well, again, in the case of that death, the circumstances, as they would be in all such cases, are going to be reviewed. And everyone, I think, understands the grief of the family involved. And so we're going to be looking at that and reviewing that. Obviously, what you've seen at Royal Inland Hospital, at Kelowna General, over the last period are adjustments we've made to try and provide staff to address the significant challenges facing the community. There's, of course, the public health emergency, that's the overdose crisis that is ongoing and affects both of those communities. There's COVID-19, and certainly the Interior Health Authority has felt the brunt of COVID-19. It, with 18% of the population, still has the largest number of active cases, significant number of people in hospital, and so on. So steps are being taken like that. We've made adjustments in terms of the delaying of non-urgent elective surgeries or scheduled surgeries, and we're going to continue to provide resources. And I think we've got to also continue across Interior Health to continue to recruit more staff to support our existing public health care staff. We've had significant success in that regard. With respect to our long-term care staff, we've added significant staff, but often in healthcare professional staff, of course, the training part requires a long lead-up. It takes a long time to be trained, as you'd expect, and we've significantly increased supports for training. But we also are taking steps every day to recruit and provide more supports, and that's what's happening in Interior Health. There are also significant challenges, I would say, in Northern Health as well, and so we're focused on those issues as well, and we'll certainly have more to say about that in the days to follow.
Tim, do you have a follow-up?
I do, thanks. I'm hoping you could give a little bit of clarity on the situation with elective or non-urgent surgeries at Royal Inland and in Kelowna. There's been a lot of confusion. Are they happening? What can you say about it?
Well, there's two kinds of, we don't really call them elective surgeries. It gives the wrong impression. They're not surgeries of choice in any way. They're medically necessary surgeries. So let's call them scheduled surgeries. And what continues to go ahead are what we call urgent scheduled surgeries. So there's some surgeries that, while not emergent, or emergent surgeries are require surgery within a certain period of time and are effectively urgent scheduled surgeries, and those have continued. I think we provided the numbers to you, the numbers that continue to happen in all of our hospitals, both emergent and urgent scheduled surgeries. There has been there has been delay of many in both Kelowna General Hospital and Royal Inland Hospital, what are called non-urgent scheduled surgeries, all of them important, and all of them will need to be rebooked and done, and we hope in the very short future, but have been delayed in order to give space to our healthcare workers, to reallocate healthcare workers to deal in particular with the issues around the wildfires, which have been quite disruptive, and importantly, the issues around COVID-19. And that's what people in the Interior Health Authority have faced really over the last month, and our healthcare workers in Interior Health are facing. And so, again, I want to remind everybody about the opportunity of getting vaccinated, of the statistics I just provided to all of you and to people in the province so that people understand the situation, that 110 people of our 130 people, or 111 I should say, of 130 in critical care in BC are today not vaccinated, that no one fully vaccinated under 50 is in critical care, and only 9 in the entire province in those circumstances in the midst of a worldwide pandemic. In short, this is a time for us to continue to pull together and get vaccinated. Get vaccinated to support yourself, your loved ones, your community, the healthcare workers who are working their guts out all over Interior Health, including at Royal Inland, including at Kelowna General Hospital, and everyone else. It's time, it's absolutely time to get vaccinated.
We have time for one more question today, and that is coming from Georgie Smythe with CBC. Georgie, please go ahead.
Thanks very much. Just again, looking ahead at Monday and the vaccine passports coming in, there's murmurs of additional protests and other civil disobedience by individuals and businesses. What does the province intend to do with these businesses that have planned to flagrantly disregard the vaccine passports before they've even gone live? Will we see fines handed down from Monday? And what do you say to rule-abiding business owners that say they're feeling exposed about Monday coming up and having to implement this?
84.3% of British Columbians are vaccinated. Should I say 85.3%? 85.3% of eligible British Columbians, which is, by any standard in the world, an impressive level of vaccination. The BC vaccine card will allow people to do things that they would not otherwise be able to do if they weren't vaccinated, or if we all weren't vaccinated. That's the purpose of the BC vaccine card. It enables, it allows, it encourages, it liberates us to be able to do some of the things that we want to do. It's also going to be a provincial health order. So it's a requirement. So I'd say to everybody, don't get mad at the businesses, don't get mad at the restaurants, don't get mad at the Prince George Cougars, don't get mad at the Canucks. This is a decision that we've taken, one that I believe is massively supported as reflected by the extraordinary response we've received, the 1.1 million plus people who've already downloaded the BC vaccine card. But this is also a requirement in BC. And I appreciate, and this has been the case at different times in the past, with, for example, laws and rules that have been brought in about smoking and other issues, that there's some people who are unhappy with that. But what I would say to all of them today is consider the impact on our healthcare system, consider the numbers in critical care, and consider the fact that at this time, it is not safe to go on with your life as normal, as before, as pre-pandemic, and not be vaccinated. It is not safe to do that and to get vaccinated. And I expect that people are going to obey what's a public health order in BC, as they have through this pandemic, and will address situations as they emerge. But I wouldn't say there's anything in the response we've received, the massive response we've received from ordinary British Columbians in every part of the province, an increase in vaccination we've seen since we announced the BC vaccine card, that there is anything other than massive support by consumers, voters, citizens in British Columbia for this initiative.
Georgie, do you have a follow-up?
I I do. Just for my colleague, you spoke to Tim and Colton about a 70-year-old woman who died Wednesday in the emergency room at Royal Inland Hospital in Kamloops. And we've heard a long list of things the province is trying to do, but at the same time, nurses are risking their jobs to sound alarms. They report staff shortages and emergency overcapacity. There's been a manager who's asked for the military to come and help, an 88-year-old woman who waited for 4 hours despite chest pains. What can you do right now to help?
Well, we're doing what we've done significantly all over the province. The purpose in some places of delaying non-urgent elective surgeries to reallocate staff to address some of these issues. But I think the message one needs to give to everybody in this COVID-19 pandemic is the need to get vaccinated. I mean, when you think of that number of people in critical care, 111 people in critical care, not in hospital, in critical care in our province who are unvaccinated. I think what that tells us, that is, for many of our hospitals, more than the entire number of beds in the hospital. That's a lot of people. And that's a lot of pressure and requires enormous time of our critical care nurses and of our staff. And so you bet we're concerned about that, and that's why we're reallocating resources within the healthcare system, and we've very significantly increased the resources in our healthcare system over the last number of years, and we're inevitably going to continue to do so, and we need to do so. But we also need people to get vaccinated. This is this moment here, a moment when everyone can get vaccinated for free in their communities, pop-up clinics all over the place, opportunities in schools and post-secondary institutions. This is the moment to do that, because this is a way we can all help everybody in healthcare, because 111 is 111 too many. And we've got to take some steps as well, and we're going to continue to provide resources throughout our public healthcare system to support doctors and nurses and others, as we've done at different points in the past. You know, we've discussed, and I think you and I discussed, Georgie, issues around our ambulance service not long ago, and we significantly increased, the largest increase in resources the ambulance service has ever seen over 3 years, and we've taken additional action, and we'll continue to take action to support our emergency rooms, including by addressing the flow of work right now in our public health hospitals, and continue to take steps to support them. But it's very challenging at this point, and people are tired of it. Of course, I understand they are. Everybody's tired of it. But the pandemic was declared in March of 2020. It's now September of 2021. In that time, our healthcare professionals and our healthcare workers have provided extraordinary care on the whole range of things for which people need treatment and the COVID-19 pandemic. And what they need, as well as all of those resource questions and all of those reallocation questions, is the help of those people, the 14.7% of British Columbians who are currently unvaccinated, to move to get vaccinated. That's a way that they can be helped, and helped right now.
And that's all the time we have for today. Thank you for joining us.
Thank you. Merci beaucoup.